Today's brief video is going to show you how to use the government Medicare website to find and enroll in the best Medicare Part D prescription drug plan to meet your needs. Now, every year the government Medicare website looks a little bit different. This is what it looks like this year, and I'm going to start off by scrolling down to find health and drug plans. Now, if you have a Medicare.gov account, which I recommend doing if you're on Medicare, is creating an account on mymedicare.gov. You can go ahead and log in, and you can save your preferences and your personal information to your profile so that it'll be there for you every year. But for today, I'm going to search as a guest, and I'm going to go ahead and enter in my zip code to view plans. I have the option now that it's October of looking at 2026 Part D drug plans. If I needed to enroll in a plan for 2025, I would click here. I'm going to select Medicare Part D drug plan, and then I'm going to select that I don't get help from any of these programs. If I did, I would select which program I received help from. And now here I can choose to add which prescription drugs I want to add. So I'm going to start off by adding just a few generic medications so we can see the search results there. Then I'm going to go back and I'm going to add in a more expensive medication and show you what that does to the search. So to start off, I'm going to enter in just kind of a low-level basic cholesterol medication, add that to my list, and a blood pressure medication that's pretty common as well. I'll go ahead and add that to my list. I can update the quantity and the dosage as well. When I'm done adding drugs, it gives me the option to choose pharmacies. I can choose which pharmacies I want to add to my list that I prefer to use, and then I'll continue to view plans. Now, automatically, this search tool will sort plans by lowest drug and premium cost. So what it's doing is it's taking into consideration the monthly cost of the drug plan itself, as well as any copays, deductibles, and out-of-pocket costs that I will pay for the medications that are on my list. And it adds all of that up and sorts it by total annual lowest for the calendar year. The plan that comes out on top for me is the WellCare Value Script at $0 a month. It shows me that my all-in estimated total drug and premium cost is $0. So that means that I'm going to pay $0 for my medications, and the plan itself is $0. So it's kind of a no-brainer. If I want to see more plan details, I can click here, and it tells me more about which of my pharmacies are preferred or in-network pharmacies, what my estimated annual costs would be for my medications, and it also shows me what I would pay per month for my medications as well. If I click on View More Drug Coverage, it gives me more information about what the costs are for different levels of medications on this plan, depending on which tier the medication falls into. You can see here that my medications that I've entered are tier 1. So if this was the plan that I wanted to enroll in, I would be able to, starting October 15th, I would be able to click on Enroll Now, and then I would be prompted to enter in information about myself, including my Medicare number, my Medicare effective dates. If this plan had a monthly premium, I would have to choose a way to pay that monthly premium. And it's important to know that if you're changing your prescription drug plan during the open enrollment period, you enroll in a new drug plan, that will automatically cancel your old Part D drug plan effective January 1st. So you don't have to contact your old plan to cancel with them. Medicare kind of only gives you one slot for prescription drug coverage. And if you put in a new plan, the old plan will get automatically canceled out when the new plan goes into effect. Now, I want to mention here that I also have a search tool that's similar to this on my website that we use that I think is maybe a little bit easier for some to navigate and can show you some more clear information about a plan's formulary, the summary of benefits of the plans. It's all very easily accessible from that website. So I'm going to go ahead and link that website in the show notes below. So check that out if you're interested. Now, I also want to see what happens if I have to add a more expensive medication. So I'm going to go back to drugs and pharmacies, and from here I'm going to choose to add another drug. So I'm going to enter in a insulin medication here. It gives me the option to add the brand name or the generic. Now I can choose. If I want to keep the brand name, I'll go ahead and keep that. And then I would add that drug to my list, click Done Adding Drugs. My pharmacies are the same, View Plans, and then I can see that a different plan comes out on top. Okay, so now a more expensive monthly premium plan is going to be the overall lowest cost plan for me. This plan has an $89.20 per month premium, and you can see that my total drug costs are $1,464. So let's click on plan details to see what that looks like. So the plan itself is $89 a month, and I'm gonna pay about $393 per year total for all of these medications. You can see that this is the most expensive medication. This is giving me the annual, all-in annual cost for the medication, and this shows you what I'm going to pay every month. Now you can see here that on this plan, Walgreens is a preferred pharmacy, and my drug costs are lower there than they would be at CVS. When I click on the Walgreens, it shows me what the retail cost is of the medication, what my cost would be before I meet the deductible, after I meet the deductible, and once I've satisfied an out-of-pocket cap. Now, Medicare Part D has a $2,100 out-of-pocket cap for 2026, and that is only for covered medications, right? So if you're taking a covered medication that's covered by a Part D drug plan, then you won't spend more than that cap. After that cap is met, your drug cost would be zero. So this shows you what I could expect to pay, which is really going to be the same in all of the phases of coverage here. So if I was taking this medication, in addition to my generic medications, then this plan is going to be the better fit for me. And you can see that if I was to choose that $0 a month plan, I would end up paying a whole lot more over the course of the year. So hopefully this information was helpful for you. From October 15th to December 7th, you can enroll in a Part D prescription drug plan that will go into effect January 1st. If you have any questions about this process, you can feel free to reach out to us and give us a call. We also have the alternative tools on our website that I think are really handy to use that let you compare the Part D drug plan that you have now to potentially switching to a new Part D prescription drug plan. So if that sounds like something that you might be interested in trying, check that out. Thank you so much for watching, and we'll see you soon.